Hello and welcome to Patho Excellence. In previous session, we have discussed step-by-step approach to HPE slide diagnosis. Now it's time to apply this knowledge. In this session, we will go through all the general pathology important slides, and our mission in this session is to see the slide like a pro, describe it in a precise exam language, diagnose it confidently, and get full marks. So let's begin. In general pathology, we will discuss slides from chapters cell injury to neoplasia and environmental diseases. First slide, identify the type of degeneration. So first of all, look for organ. So here you can appreciate glomeruli, and these are the tubules. Tubules having vascular change. So in high power view, you can see nucleus is there and surrounding cytoplasm show vascular change. So this is a slide of hydropic degeneration or vascular degeneration or cloudy change. Second, this is a smooth muscle cell, and in between the cells bundle you can appreciate pink glassy appearance of material. This is the hyaline degeneration. So this is the slide of leiomyoma, which is benign tumor of smooth muscle cell, and this is the hyaline degeneration. In this organ you can appreciate mucin like material deposited. So this is myxoid degeneration. This is the pale blue appearance of material in between the cell. This is a slide of fibroadenoma contain myxoid degeneration. So this is pleomorphic adenoma slide containing myxoid stroma and cells. This is mucinous area in a intestinal tumor, adenocarcinoma, and here the mucin pool in which you can appreciate signet ring type of cells. So this is mucinous adenocarcinoma. Easy and commonly asked slide. This is a liver. How you will appreciate with the help of portal triad, and these are the hepatocytes. In high power view, you can see vascular deposition in the cytoplasm of hepatocytes. So this is a fatty degeneration in liver. So this is fatty change. Now a question is, what is macrovesicular fatty change and what is microvesicular fatty change? Common in alcohol and some hepatitis virus infection. Now types of pigment. You know endogenous and exogenous pigment. So identify organ here. So this is the lung showing alveoli and macrophages, but the important to see is black colored chunk like deposition in the parenchyma of lung. So this is anthracotic pigment. In gross you can appreciate black colored deposition of pigment in the lung. Again, organ, alveoli, brown pigmentation in the alveoli. So lung with black anthracotic pigment in some areas. High power view shows macrophages in the alveoli containing brown pigmentation with, you can appreciate here, nucleus. Surrounding alveoli is thickened wall, and this is hemosiderin pigment. So what is the cause for heart failure cell deposition in lung? It is chronic venous congestion due to left-sided heart failure. And what is the special stain for hemosiderin pigment? It is pearl stain. So iron containing pigment, so pearl stain will helpful. Cardiac muscle fibers, striation, nucleus, and abnormal is perinuclear deposition of golden brown pigmentation. So this is lipofuscin pigment. Another names are wear and tear pigment or aging pigment because it is commonly increase in amount in aging patients' heart and liver and some another organ like kidney. So this is the normal gross appearance of heart, and this is atrophied brown pigmented heart. So it is called brown atrophy of heart due to excessive amount of lipofuscin pigment. And next pigment is in the skin. Here you can appreciate it, the basal layer cells containing brown black pigmentation. These are the melanin cells containing melanin pigment. So melanocytes having melanin pigment. Here this slide is having excessive melanin pigmentation. So this is normal skin with ulceration, excessive deposition of melanin pigment, and some malignant appearance of cells. So this is a slide of malignant melanoma. Here, first of all, identify organ. You can appreciate small blue cells. So mostly it is lymphocytes having this abnormal pink fibrillar extracellular material deposition. It is called amyloid deposition. So this is the slide of lymph node showing amyloidosis. Now what is the special stain? So red color appearance to this amyloid pigment. So it is Congo red, and in polarized light it gives apple green birefringence appearance. Important thing to know is what is sagospleen, what is lardaceous spleen. So two patterns are seen in the amyloid deposition. In sagospleen, there is mild to moderate enlargement of spleen. Cut surface show these translucent waxy nodules resembling sago grains. And microscopically, it mainly involves white pulp, periarterial lymphoid sheath, and they form discrete deposition. Now, lardaceous spleen, it is diffuse enlargement, marked enlargement, and cut surface show map-like areas resembling lard, means thick pig's skin. Microscopically, deposit starts in the wall of splenic sinuses, which progress till they form large diffuse mass. Now, different types of necrosis. Here, the normal histology of testis showing seminiferous tubules. But in this slide, you can appreciate only the outline of these seminiferous tubules and total loss of cellular architecture. So, this is a coagulative necrosis due to ischemia, in which architectural outline is preserved but cells are destroyed. Same diagnosis in this slide, but organ is different. Here it is kidney, glomeruli normal, but tubules are abnormal. So these are, you can compare with normal. These are the normal tubules, and these are the tubules having coagulative necrosis. So this is the slide of acute tubular necrosis of kidney. Here, normal brain parenchyma. Here you can see edematous appearance with loss of cell architecture and some inflammatory cells, and this is a liquefactive necrosis. In gross appearance of brain, you can appreciate edematous area with necrotic area showing liquefaction. So, brain is the commonest organ for liquefactive necrosis. This is again a type of necrosis, but the appearance is different. See, this is granular pink material surrounded by, this is giant cell, epithelioid cells, fibroblasts. So, example is of caseous necrosis. And you can appreciate this is the gross of lymph node having tuberculosis, and this is cheesy appearance of caseous necrosis. This type of necrosis is in a fat containing organ like breast tissue or pancreas. So this is a example of fat necrosis. In this, the gross appearance of acute pancreatitis shows white chalky deposits, and because of calcium soft formation, it is called saponification. There is lipid breakdown in the mesentery. Because of enzymes, excessive enzymes, they are liberated into the surrounding mesentery and they will destroy fat and causes fat necrosis. Identify with the help of RBC. See, this is the lumen RBC. So, this is blood vessel having pink deposition and some inflammatory cells, mostly neutrophil. So this is a fibrinoid because the appearance is like fiber. So fibrinoid necrosis of vessel wall. See, normal appearance of blood vessel, if you see, you can see lumen, tunica intima, media, adventitia and elastic lamina. Here the lumen is narrowed and wall is thickened but containing fibrinous pink material and inflammatory cells. So this is fibrinoid necrosis and it is seen in a patient with polyarthritis nodosa. So we have discussed all 5 types of necrosis, and these are the gross appearance and these are the common causes of different types of necrosis. Now, dry gangrene, wet gangrene and gas gangrene. So dry gangrene, it is due to ischemia and most common is a coagulative type of necrosis. In wet gangrene, ischemia plus secondary infection is there, so there is liquefactive necrosis. And in gas gangrene, it is a subtype of wet gangrene associated with the Clostridium welchii, and it produces gas in the subcutaneous tissue. In histological appearance of gangrene, you can see thrombosed vessels, inflammatory cells and total loss of architecture. Right? Okay. So next slide shows multiple blood vessels. How will you identify blood vessels? So with the help of lumen containing RBCs, and here abnormality is this purplish deposition in the media of the wall. So this is called medial wall calcinosis because calcification in the media of the artery. And another name is Monckeberg calcification. Right? So this is the example of dystrophic calcification. In high power view, you can clearly visible calcification, deposition of calcification in the media. Example of again calcification, but the organ is kidney because you can identify here tubule But in this tubule, you can see deposition of calcium. So this is the nephrocalcinosis, and this is a type of a metastatic calcification. So what is the difference between dystrophic calcification and metastatic calcification? This deposition, dystrophic is mainly in the dead, degenerative, necrotized tissue, and calcium metabolism is normal with normal serum calcium level. Here in metastatic calcification, there is deposition of calcium in a normal and alive tissue. But the calcium metabolism is deranged and patient serum level of calcium is high. And common causes is hyperparathyroidism, prolonged immobilization, hypervitaminosis D, milk alkali syndrome, and hypercalcemia of infancy. And this is due to high pH in the certain organ like lung, stomach, and blood vessel, cornea, as well as in kidney. Because of hypercalcemia, you can see metastatic calcification. Okay. In next slide, first of all, organ. So this is, you can see alveoli, and there is deposition of some material or fluidy material in the alveolar space. In high power view, you can appreciate alveolar wall with congested capillaries and pink fluidy material. So this is edema. So this is a slide of pulmonary edema. So edematous fluid in the alveoli with macrophages in the alveoli. Already we have seen this type of pigments, hemosiderin pigments. So this is the slide of chronic venous congestion of lung, showing thickened and fibrous alveolar wall containing heart failure cells, thrombosed congested vessels, and in gross appearance you can see brown induration of lung. So lung is thickened instead of sponginess and brown colored appearance. So this is a slide of CVC lung. Okay, here in gross appearance, typical gross appearance, it is a nutmeg appearance of liver. In nutmeg appearance, these are brown dot and surrounded by pale area. So this brown dot, if we see in microscopically, represent centrilobular area. So central vein is dilated, and because of vascular pressure and overload, the surrounding hepatocytes are damaged and destroyed, and sinusoidal dilatation and congestion is excessive in this area. So it will give a red color appearance to this area, and surrounding to this centrilobular area there is normal hepatocytic parenchyma, so it will give a pale color appearance. So this is the slide of chronic venous congestion of liver, and most commonly it is seen in the right-sided heart failure. So right-sided heart failure will lead to chronic venous congestion in liver and spleen, and in case of left-sided heart failure you will see CVC lung change. In spleen you will see Gamma-Gandhi bodies because of right-sided heart failure. This slide, the organ is blood vessel, but in lumen you can appreciate attached thrombus. So what is thrombus? It is a organized clot attached to wall, and it is having a 3 component: RBC, leukocytes, and pink fibrinous material, and these all components are separated by this line called line of Zen. So this is thrombus. Here this is the lung And in blood vessel, you can appreciate fat vacuoles, and this is the blood vessel containing fat embolism or bone marrow embolism. This one, as well as here also small vessel containing embolism. So commonest question, what is the difference between antemortem thrombi and postmortem clot? So you can see by microscopically there is presence of line of Zan. In postmortem clot there will be chicken fat, yellow, and currant jelly will red color jelly will show red color appearance. Here grossly it is dry, granular, firm and friable. Here it is gelatinous, soft and rubbery, and this is adherent to wall, while postmortem clot is weakly attached to wall and easily removable. Shape, it will not fit through the vascular contours, and in postmortem clot it takes the shape of vessel or bifurcation. Now, what is emboli? So emboli is a freely circulating part of some material or part of thrombus, and thrombus mostly attached to the. So different types of emboli: fat embolism, amniotic fluid embolism commonly seen in pregnancy, tumor embolism, gestational trophoblastic disease, septic emboli, hydrated cyst, some IV injection of particular material will lead to embolism, and gas embolism. Now, types of infarct. Here in gross of spleen show white area with a base at the capsule, and it is called white infarct. Here you can see coagulative necrosis. In this, you can see red colored appearance of the slide because of excessive RBC or blood collection. So this is red infarct. Here you can appreciate red colored area involving lung, some also here, and this is the black pigmentation of anthracotic pigment. So how will you differentiate red infarct and pale infarct? It is hemorrhagic infarct seen due to venous occlusion, and the organ having double blood supply generally have a red infarct like lung, brain, intestine and liver, while pale infarct or white infarct is due to arterial occlusion and the organ having a single blood supply, mostly in the kidney, spleen, myocardium. Okay. Here this is a slide of granulation tissue. Granulation tissue comprising of three elements: vascular proliferation, small blood vessel you can appreciate vascular proliferation, some fibroblastic proliferation, and these are the inflammatory cell infiltrate. So whenever there is healing phase, there is appearance of granulation tissue. Now, this is a tubular organ, and this is the lumen. Here, first of all, identify the organ. So this is appendix. You can appreciate lymphoid follicles. Number of follicles are enlarged, increased and enlarged follicles. Mucosa of appendix, and here the ulceration of mucosa. Right. So this is a slide of appendicitis. Now, in high power view, you can appreciate polymorphs in the submucosa and some in the mucosa. So this is a slide of acute appendicitis. Again, appendicular mucosa with some parasite. So this is E. vermicularis parasite in the lumen of appendix. Here you can see E. vermicularis with eggs of E. vermicularis in the slide. Here this is normal brain parenchyma, but here you can appreciate number of polymorphs are deposited, and this is a slide of acute meningitis. So you have to differentiate pyogenic meningitis, then tuberculous meningitis and viral meningitis. So this is a slide of pyogenic meningitis. Okay, now identify organ. Here you can see a scanner view in which pink necrotic material surrounded by normal tissue. So in high power view, these are the lymphocytes. So this is the slide of a lymph node. The important clue is giant cell. So this is a Langhans type of giant cell with this slipper shaped epithelioid cells, fibroblast, lymphocytes. So this is the slide of lymph node having granuloma. And because of appearance of Langhans giant cell, it is a with the if caseous necrosis is present, then it is tuberculous inflammation. Now, what is giant cell? What is epithelioid cells? From where epithelioid cells are derived? You should. So macrophage in tissue, they are converted into activated macrophage or epithelioid cells. Then epithelioid cells are collected in a one cytoplasm, and they are differentiated into the different types of giant cells. Again, organ, you can appreciate intestinal glands, so the part of intestine. Here giant cell in low power view with round nodular appearance of inflammatory cells, fibroblast, epithelioid cells. So these are the granuloma in the intestine. So this is a slide of TB intestine. You can see in high power view Langhans type of giant cell having horseshoe appearance. Now see, this is giant cell, now you know, and granuloma. Now granuloma is there, but organ is which you can identify here, alveoli. So this is the tuberculosis of lung. Now question is, what are the different type of giant cells? So these giants are large cell comprising of multiple nuclei and all sharing the same cytoplasm. It is divided into physiological giant cells and pathological giant cells. Now physiological giant cells are osteoclasts, megakaryocytes and cytotrophoblasts. Pathological giant cells are divided again into inflammatory and tumor giant cells and some other types of giant cells. So this is classification of giant cell like Langhans giant cell, foreign body giant cells, Teuton giant cells, Ashkoff giant cells and Croton giant cells. In tumor giant cells, you will see Ritz-Sternberg giant cell, osteoclast-like giant cells, and tumor giant cells. Here, Langhans, you all know it is having a horseshoe appearance, foreign body having multiple nuclei in the center. It may go up to 100. Teuton giant cells, it is a ring-like appearance, arrangement of nuclei with surrounding form appearance of cytoplasm. And Ashkoff giant cell are commonly seen in rheumatic fever, and it is having a surrounded by caterpillar cells. Cryptococcus infection will give a Croton giant cells appearance, and it is having a mucinous capsule surrounding the giant cells. Ritz-Sternberg cells, hallmark of Hodgkin's lymphoma. They are binucleated with prominent nucleoli and perinuclear halo. Then again osteoclastoma and some bone cyst will show a giant cells which are multinucleated in appearance. Tumor giant cells having a nuclei, multiple nuclei having a malignant look. So these are the high-grade tumor containing tumor giant cells. Okay, this slide is a case of rhinosporiosis in which infective agent is Rhinosporium seberi. This is the sporangia, and it contains, this is a spore, it contains multiple sporangia. Okay, now you identify all these three slides. See, this is a fungal infection, aspergillosis. So, fruiting body and hyphae having acute angle. Here is actinomycosis, cotton wool appearance. This is mucormycosis, stout and thick hyphae and wide angle or different angles at the hyphae border. So, aspergillosis, mucormycosis, actinomycosis. This is the slide showing scoliosis. So, it is Echinococcus granulosus or hydatid cyst. Here you can appreciate papillary-like projections and having centrally fibrovascular core, and the lining cells are squamous cells. In high power view, you can easily appreciate squamous cells and centrally placed fibrovascular core. So this slide is of squamous papilloma, benign tumor of skin. Here again a papillary projection. See, this is the normal intestinal epithelium. Here also, and here there is a projectile growth or papillary like growth, and the lining is intestinal. So glandular epithelium is there. So this is a adenoma. So slide of adenoma. Okay, so these are the fat cells. Number of fat cells are increased. So easiest slide in exam, it is a lipoma, benign tumor of adipocyte tissue or fat cell. So it is a slide of lipoma. Here you can appreciate nodular appearance of growth, and in high power view you can appreciate smooth muscle cell. So tumor of smooth muscle cell, it is called leiomyoma. So benign tumor of smooth muscle cell, leiomyoma of uterus is common. Here you can see Fibroblast proliferation with pink material. So these are the collagen producing fibroblasts, excessive in number. So this is a benign tumor of fibroblast called fibroma. This is a slide of fibroma. Here, lobular appearance of blood vessel proliferation and mostly the small blood vessels. In hyperview, you can appreciate blood vessel proliferation. So this is a benign tumor of blood vessel called hemangioma. So excessive number of capillary proliferation is there in the hemangioma. Again, hemangioma, but you can appreciate large spaces with thick walled appearance, and it is lined by endothelial lining, so it is called cavernous hemangioma. So you have seen all the important slides of general pathology slides, and before your exam, revise this clue, hallmark or buzzword table, and you are not just ready, but you are diagnosis ready. So good luck, and remember, see it, name it, explain it and score it. Now in next session we will look for systemic pathology slides, and stay tuned for this next session. All the best.